healing yourself from within, the connection between mind and body and spirit, more fresh air and exercise. Being rather pragmatic about it, the quote I kept coming back to, though, is from Susan Sontag from her book, Illness as Metaphor. Everyone who is born holds dual citizenship in the kingdom of the well and the kingdom of the sick. Although we all prefer to use only the good passport, sooner or later each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. While we're inhabiting whatever place we're a citizen of in that particular moment, let us be mindful of those who are citizens elsewhere. And for levity, Doug Larson wrote, life expectancy would grow by leaps and bounds if only green vegetables smelled as good as bacon. It seems to me that health is one of the things in life, like love or community or purpose, that when you have it, you're truly blessed. And when you don't have it, you miss it something fierce. As the French say, à ta santé, to your health.
Don't forget, fellowships are next week. If you haven't gotten your reservation in yet, do so now before deadline is tomorrow. Please note there's different dates and times and locations than the normal meetings, which will be fun. We'll kind of mix it up. Thank you again to Rob Stone with Cosi, Demon, and More PC for sponsoring January's Rotary Connect Happy Hour. Young and Carolyn Cho are hosting their 4th annual Club 31 Ski and Networking Day, Saturday, February 13th through the 14th. Spots are limited. So make your reservations now. Young, I know you're here today, so wave your hand and let everybody know where you're at. See Young. Save the date for our Scholastic Arts Award Expo. This will be an evening event, Thursday, March 3rd at the History Museum, tentatively from 5:30 to 7:30. Look for event registration coming soon. We have birtharians this week. If you're here, please stand up so that we can congratulate you. That's a big list. Who's having a birthday this week? Anybody here? Happy birthday.
Happy birthday.
We have quite a few guests today. Chad Adams is a prospective new member, sponsoring by Mark Donovan. Chad, welcome. Lots more guests have come with members. If you'd please stand and so that we can recognize you. Dave Carpenter is a guest of Pam Adams, along with Michael Mosicelli. Excuse me. Marty Everill is here with Chuck. Shane Thomas is a guest of Julie Freshman. Jane Houston came along with Bill. Carla Marlowe is with Jim Marlowe. Laura Conte with Mark Montgomery. Tom Boyer is a guest of Nick Muller. Carolyn Stewart came with John. Stephanie White came with Eric. And we also have one guest that Francisco Vargas is here with Don Lewis. He happens to be one of our high school scholars. One of the things that we do with that is not only the monthly stipend and visiting to see how people are doing, but putting together some connections. So he's here to talk with Scott White about School of Mines, and that's maybe a connection that would work out for him. Have a good week.
So I want to thank the program committee and Julie. I heard you over here somewhere. Wave, Julie. Oh, over there. All right. So Julie and the program committee, thank you very much for bringing us another relevant Rotary program, and also for trying something new, maybe having a little drink, a little more time to socialize. So we're going to have a great talk tonight. And it reminded me of the man that goes to see his doctor to receive the results of his checkup. And the doctor says, well, I've got good news and bad news. And the guy, full of trepidation, says, well, doctor, give me the good news. He says, well, you've got 24 hours to live. He says, with good news like that, what is the bad news? He says, I should have told you yesterday. So to introduce our speaker about the good, the bad, and the ugly of healthcare, please welcome Bill Houston.
Ladies and gentlemen, it's my honor to introduce Dr. Vince Markovchik, MD. And he has 2 other degrees with about 5 letters, and I won't try to give you those. He worked in the emergency room of Denver General Hospital 35 years and was the senior physician for 15 of those 35. He's also a professor emeritus at CU. But the reason he's here is Judge Boning and I took a course from Dick Lamb at Denver University, and Dick Lamb's guest speaker is the doctor on the subject of health insurance. He gave a 2-hour lecture. We have a chance for an hour of that tonight. And when it was over, Larry Boning and I went up and asked if he gives public speeches. And he said, the message is so strong every time I can. So he's here tonight as our guest. Please help me welcome the sophisticated Dr. Markovich.
I wish my wife were here to hear that sophisticated thing. Thank you for inviting me. That's an awful bright light back there. Is there a way to tone it down just a little? Anyway, I worked at Denver General and Denver Health as a full-time emergency physician for 32 years. The last 20 years, I was the director of emergency medical services there. And I worked very frequently in the emergency department as a clinical emergency physician, about 3 times, 4 times a week for those 32 years. And I don't think there was ever a day that I worked that I didn't encounter a patient with a very serious illness or injury who was most of the time working, sometimes 2 jobs, and said, how am I going to pay for this? I have no insurance. And I started thinking, why is it that so many people in the richest country in the world have no health insurance? So I started looking into this subject, and I've been giving talks relevant to this topic for the last 15 years. I'm currently doing an 8-hour course, 2 hours a week for 4 weeks for 2 sites at the Auctioner Lifelong Learning Institute at Denver University. And so Governor Lamb asked me to condense this course into 2 hours, which I did. And now I'm going to try and do it in 45 minutes. And I'm going to add something new, which is Amendment 69, which will be on the ballot here in Colorado in November. So I'm going to talk first, before I get into the nuts and bolts of Obamacare. See if this is, got to turn it on to make it work. First of all, unlike the political leaders who make decisions on health care, I don't have any financial interest to any of these people. Let's just look at the economics. In 2013, we spent $2.2 trillion on health care, 17% of GDP, $9,200 per capita. And it's now a little over $3 trillion that we're spending. The expenditures per capita keep going up and up and up, and at an unsustainable course. And when you compare us to other countries, we spend far more than any other of the 23 developed countries in the world that offer universal health care to all of their people. We spend twice as much as most, and we still have, even after the implementation of Obamacare, right now we have 29 or 30 million people still with no health insurance. So how do we spend $3 trillion a year? Well, Medicare is now over $600 billion a year. Medicaid is over $500 billion with the Obamacare Medicaid expansion. Private health insurance premiums are now at about $1 trillion because that's who provides
outside of Medicare, the bulk of insurance coverage for our citizens. Out-of-pocket spending, we spend far more out-of-pocket for health care than any other people in any other country in the world, and that's an amount people generally don't think about. We're talking about co-pays, deductibles, over-the-counter medication, things that aren't covered by insurance, hearing aids, eyeglasses, those kinds of things, dental care. Hospital, about $1 trillion goes back to hospital bills, and half $1 trillion for the provider, physician, and clinical services bills. And the prescription drugs have been growing at an astronomical rate. We're now over $350 billion a year that we spend on prescription drugs. I wish I had time to go into this one because this is delightful for me to get to talk about. It gives me chest pain. So who pays the $2.9 trillion, or now $3 trillion in these medical care costs, or medical costs, health care costs? Well, people don't realize it, but 2/3 of it is already funded either directly or indirectly by tax dollars, either local, state, and primarily federal tax dollars. The bulk of Medicare, except for the 25% funded by premiums that each Medicare recipient pays, is paid for by taxes. Medicaid is a shared program, 60% federal, 40% state. Obamacare expansion is covered 100% by the feds. The U.S. Public Health Service, every person who works for a government, state, local, or federal, has health insurance from a private company usually, and that's funded by tax dollars. The only group of people in our country guaranteed medical care by the Constitution are prisoners. Think about that. Not to provide medical care would be cruel and unusual punishment. They get medical care. It's not always the best, but they do get it, and it's paid for by taxes. The VA, public hospitals and clinics. Here's one people never think about. It's the tax deduction that the employer and the employee gets for your private health insurance. Okay, think about that. That's $250 billion a year. It's actually more than that now. And think about the fact that the employee who gets paid the most pays less for their health insurance premium than the lowest paid employee at that company. So I was paying a lot less for my health insurance at Denver Health than the housekeeper because I was in a higher tax bracket. Now, how screwed up is that? But that's the way the system is set up. The Obamacare subsidies and overhead in 2015 were $76 billion. That's going to continue to grow dramatically, particularly because they're not going to get the money to offset these costs. Before I get into Obamacare, 1/3 of our health care dollar that's allegedly spent on health care is either wasted or secondary to fraud or abuse. And I just gave a 2-hour lecture on this today for DU, and this is fascinating to get into. But there's a huge amount of dollars out there that aren't going to health care, some that are going to health care, but they could be much better spent if we could curb some of these issues. 1/3 of our health care dollar doesn't go to health care. It goes to overhead and administration. Okay? Now you say, well, you got to have administration to run a health care system. That's true. But in contrast, every other country in the world, I don't think none of them spends more than 10%. Many of them spend 5%, 6%. And Medicare, overhead for Medicare is 3%. Think about that. The Medicare overhead is 3% for traditional Medicare, not Medicare Advantage. Examples of waste. The big amount is administrative overhead. And this involves, if you could just figure out how to get away with the hospitals and doctors trying to figure out how to do billing and collecting and getting pre-approvals from a myriad of private insurance companies, and not have the insurance companies hire a whole bunch of people to figure out how not to pay the bills, how not to give approvals so they can make more money. That is $376 billion a year. Just that noise in the system. Private insurance. Their overhead is now limited to 20% by law, 15% if it's a large company insured. This 20% is not really 20%, it's more because they figured out how to play the accounting game. And anyway, I don't have time to get into all of that. Medicare Advantage. I'm sure many of you here have, or some of you here have Medicare Advantage. That's where Medicare transfers in Colorado about $800 a month to your private insurance company, who are then responsible to provide your medical care, pay for your medical care. And that's calculated based on what Medicare is paying in a geographical region for medical coverage in that area. But in addition to that, the private insurers in Congress have negotiated an additional 17% on top of that for their overhead and the trouble that they have in setting up their systems. That 17% that should not be paid by Medicare but was supposed to go away under Obamacare. In fact, it's gone up. It hasn't gone away. And the administrative overhead for Obamacare. That's going to be not as much as the private insurance overhead, but it's significant. Examples of fraud. Man, this one gives me chest pain. Hospital and physician billing fraud. That's big. The biggest one, however, is the drug companies and the pharmaceutical industry fraud and abuse. Fraud because they just commit fraud. Off-label marketing of drugs. Inappropriate prescribing, getting doctors to do this, encouraging it. This is huge. And they're paying billions of dollars back to Medicare for this fraud. But it's simply the cost of doing business. To them, it's like getting a speeding ticket without ever losing your license. And they just keep on going. Kickbacks to providers. DaVita here in Denver, a year or so ago, $356 million they had to pay back to the federal government for kickbacks. And they said, oh, yeah, we promise not to do it again. Nobody ever goes to jail. Like the banks, nobody goes to jail. This is white-collar fraud. Ambulance and helicopter billing, ambulance billing fraud. Medical device and home health billing, claiming people are getting these things and not even getting them. And hospice, that's a big one. 85% of hospices now are or maybe 80% are privately owned, usually by big corporations, and there's a huge amount of fraud going on there. Examples of abuse. Have you ever looked at a hospital bill? In fact, I would encourage you to demand an itemized bill anytime you or any member of your family go to the hospital and look at it. Look at that bill. My wife went in for surgery last year, in the morning, surgery in the afternoon, one night in a regular hospital room, home the next day. You know what her hospital bill was? $80,000. 80. The insurance company paid 20. Medicare would have paid about 15 or 14. But these charges are outrageous. And think of the poor person who doesn't have insurance, or whose insurance doesn't cover him for that hospital because he's out of network. This is a big problem. Read Stephen Brill's article March of 2013 called The Bitter Pill, How Hospital Costs Are Killing Us. A very enlightening article. Medical device charges are grossly inflated. Certainly drug charges are just out of control, totally out of control, because there's no way to put any controls on them in our country. The free market isn't doing it either. They're not doing the job they're theoretically supposed to do. It's not happening. And then there are certainly overcharges from providers as well. So let's get into the good parts about Obamacare, and there is a lot that's good about it. The real name for Obamacare is the Patient Protection and Affordable Care Act. Nobody ever says the patient protection. They either say Affordable Care Act or Obamacare. But this patient protection is huge. It's a big deal. And think about this in terms of all the political leaders that want to repeal Obamacare. Think about what would happen to these good things if they went away overnight. And I apologize for the small print. I had to change the format of the slides, and I didn't realize it would project so small. The first thing it does, one of the things it does is prohibits rescissions. What's rescissions? Let me give you an example. A woman has her own business, a real example, paying premiums on her own for 20 years, 25 years, gets diagnosed with breast cancer, expensive illness. Insurance company goes back through all of her medical records, says you were on prescription medicine for acne when you were a teenager and you didn't put this on your original application, so we have a fraudulent application and we cancel your insurance. That was happening more than anybody could believe. One of the ways private insurance companies could get out of paying the bill. That's now illegal. Can't do it. Eliminates lifetime caps on an illness. $1 million in coverage sounds a lot, but when you start looking at hospital bills, that's not a lot of money. So someone would have reasonable good insurance, get sick with a serious illness, reach their $1,000 cap, the insurance company says, we're done, we're not going to pay any more. And then if on top of it they were ill enough to lose their job, they're totally screwed. A lot of these people went bankrupt. In fact, 60% of personal bankruptcies are due in whole or in part to inability to pay an unexpected medical bill. And that has only gone down a small amount under Obamacare. It requires that all insurance companies, including Medicare, provide free preventative care because mammograms and colonoscopies and other preventative studies for the average person on Medicare, they couldn't afford some of the copays to get these tests done. Now there isn't any copays. That's a good thing, and it should pick up a lot of cancers and a lot of things early rather than late, and things like vaccinations are included in this as well. Overnight, this provision where you could keep your kids on your policy till they're 26 enrolled almost 3 million young people by keeping them on their parents' health plans. A very good thing because the young invincibles would never go out and buy insurance on their own. Expansion of primary care and community health centers. We have a real problem in this country with access to primary care, particularly for the poor, people on Medicaid, and in certain rural areas. And there's money here that has expanded that, and that's a good thing. This is a big one. They cannot refuse insurance to anybody for a pre-existing condition. Now think about it. If you're a corporation, an insurance company, with stockholders, what is your primary duty as that corporation? It's to turn a profit and keep the stockholders happy. It's not to provide high-quality medical care to real sick people, is it? And if you're an insurance company, how do you maximize your profits? Well, you insure the healthy and you avoid the sick. And that's what was going on in regard to not selling insurance to people with pre-existing conditions. And they were free to define this any way they want. I had an associate who retired from my department at age 55 when he was eligible for benefits from the city, had land in Montana, had plans to build a house, and what he didn't realize was the 3 insurance plan options in our retirement plan, none of them covered him in Montana. So he went to the 2 companies in Montana, said, I want to buy insurance. Tell me what I need to pay. They said, we won't sell it to you. He finally figured out why. They said, because he's 55 years old. They have an age cutoff. Just won't sell insurance to people like that. That's all gone away. And that has been a boon for people with serious conditions that they just couldn't afford to get taken care of. It limits insurance companies' overhead to 20%. So it means of every dollar they take in premiums, they have to spend at least 80% on direct health care, or they have to rebate the difference to the people paying the premiums. Now, the first year this was in effect under Obamacare, about $2 billion were actually rebated in this country. Not a dollar since then, because they learned how to play the accounting game. It decreases the amount of money. This is the craziness, the Medicare Part D donut hole. Whoever thought that one up? But anyway, the pharmaceutical company, when they were threatened with Medicare being able to negotiate drug prices, got Obamacare legislation not to put that in. And they said, when you get into the donut hole for brand name drugs, we'll pay 50% of the cost. The donut hole starts at about $2,900 and it ends at about $4,700 this year. Private insurance subsidies of up to 400% of the federal poverty level. So that means anybody in 2015 who had an income, an individual, higher than $11,500, where they would have qualified for Medicaid, up to about $3,700 could get subsidies, and for a family, the subsidies are $46,000 and $94,000. That's the top limit, and these are progressive. So the lower your income, the higher percentage of your private health insurance premiums are covered by Obamacare. Okay, so the more money you make, the lower the percentage. When you get to these limits, you pay the full price for your policy. And that's enabled 17 million more people to access private health insurance under Obamacare. Most of those were able to do it because of the subsidies. Otherwise, they simply could not have afforded it. It expands Medicaid to 138% of poverty, and the increased numbers are funded 100% by the federal government until 2019, when they're 95%, and then in 2021, it's 90%. The curious thing is that there are 19 states that have refused to expand Medicaid to cover these folks. So there's about 5 to 6 million people eligible for the Medicaid coverage that aren't being covered. And if their income is at a Medicaid level, by law, they can't purchase insurance through Obamacare. So there's no possible way for them to get insurance. This is craziness. Not only craziness, it's a national shame that this is happening in our country. And I think it's all because of politics. Why can't people put it aside and say, what do we need to do for our people? It's not happening. And it prohibits junk insurance. Do you remember the big hullabaloo when Obama said, if you like your health insurance, you can keep it? Well, somebody gave him some bad advice there. All he had to say is, if you like your health insurance and it meets minimum standards, you can keep it. Amazing how many people had total junk policies. It wouldn't cover anything. My daughter had one of these until I finally got hold of it, and there were 62 exclusions in this catastrophic policy that she had. They wouldn't have paid for anything. And so why should you have junk insurance and be paying for something where if you really got sick, it would mean nothing to you? So that's what junk insurance is. The number of uninsured Americans have gone down to about 30 million. It was projected to go down to 23. The difference in those two lines is because the A number of people that should be covered by Medicaid expansion aren't covered, the 5 million people. And that's thanks to the Supreme Court, where they told the states they could individually decide whether to cover these people or not. How are the Obamacare premiums determined? 4 or 5 questions. How old you are, and they can triple your premium based on age. Increased premium for smokers, where you live, because geography is one of the ways premiums are set. For example, in Aspen or Vail, people are paying twice as much for the same insurance as they are in Denver. And the reason for that is they're one-hospital towns, and these hospitals refuse to negotiate discounts. And they're charging their full amounts, and so it's passed on as premiums. Annual income, that determines the subsidy. And these premiums are not determined by the government. People are blaming the federal government for the increase in premiums. They're determined by the private insurance companies. The government's not setting these premiums. What's the penalty? It's pretty minimal. This year it's 2.5% of your income, or $695 for an adult, whichever is higher. So think about the young, healthy, 28-year-old, 30-year-old who has a job. He's getting $50,000 a year, which means he doesn't qualify for any subsidies, and his premium is $6,500 to $7,000 a year. He's rolling the dice and saying, I'm healthy, I'll pay the penalty, I'm not going to pay that premium. And that's happening, and that's a problem. The bad. So that's all the good stuff. Think about taking those insurance reforms and the things that have stopped the abuses of insurance companies, repeal Obamacare and take them away. Almost 17 million people will lose private insurance. Another 5 million Medicaid people will go off Medicaid. And so what do you do about that? Nobody seems to want to talk about that. What do you do if you repeal this, the law? Now we get into the bad. That was all good news. It'll still leave, right now, 30 million uninsured, maybe a little less than that in the next year or two. But think about that. That's 10% of our population. Now, 11 million or so of those are undocumented immigrants, because by law, even if they were working, had money, and wanted to buy insurance through Obamacare, they're not allowed to buy it. And of course, they don't qualify for Medicaid. So where do they get their medical care? They come to the ER when they're real sick, because they can't get ongoing preventative care, and it costs a heck of a lot more. And indirectly, the taxpayers are paying for this, or people with private insurance are paying for this. It really will not significantly decrease medical costs. They're making some attempts at cost controls, and so far they haven't been real successful. It increases the bureaucracies, which cost money. The undocumented immigrants are excluded. 5 to 6 million Medicaid eligible are uncovered because of the 19 states that won't allow them to be covered. And it leaves most people underinsured. What's underinsurance? Well, the copays and deductibles are at such a high level that the average working person can't even afford those. And the way to keep your premiums down is to have your copays and deductibles go way up. Now, they are limited under Obamacare to $6,000 for an individual, $12,000 for a family. But that changes if you go out of network for your care. It can be more. It will not eliminate medical bankruptcy. When Romney Care took effect in Massachusetts, the medical bankruptcy decreased by 10%. It went from 69% down to 60% at that time. It will not control rising premiums. That's the biggest problem we're facing right now. And it will not generate enough revenue to cover costs. Had they gone through with what was in the law, rather than, for a whole bunch of political reasons, not gone through with this cost savings. It should have covered it, but it won't now. The unintended consequences. The law requires employees, although they deferred this, with 50 people or more in their company, to purchase health insurance for anybody who works more than 30 hours a week. So that solution to that is to have them work 29 hours, tell them they qualify for subsidies, and let the government help them with their insurance. In fact, the biggest employer in the country, Walmart, is great at figuring out how to do this, so they don't have to pay any benefits. Small employers under 50 are doing the calculations and saying, hey, you know, you could do better if we just give you a little more money and you go out and purchase your insurance on the exchange because you qualify for a 50% reduction in your premiums. The very low penalty we've talked about. Other unintended consequences, the Medicaid uninsured. Private insurers are feeling the squeeze because the people who really need care have bought insurance, and they're expensive. The young, healthy people who need very little care are not buying into this, so the premiums are not there. And the private insurance companies are feeling the squeeze. United Healthcare has threatened to completely pull out of the exchanges next year. It's one of the 3 biggest insurance companies in the country. There were supposed to be risk corridors that buffered these issues for private companies, but they're not available anymore. And so what are they going to do? They're not going to lose money. They're not going to not make profits. The only alternative private insurers have is to increase premiums. And this is how healthcare costs are outpacing incomes. This is the average health per capita spending as a percent of median income. And you can see in 2011 it was over 30%. And we're going to get into median income in a minute. This is the way health insurance premiums have dramatically increased over the last 20 years or so. And you can see we're now up to 17,000 plus. The green is the employer contribution, and the blue is the employee contribution. And nobody talks about this when they talk about wages being flat. I'm convinced one of the big reasons wages have not increased very much over the past 20 or 25 years is because of the increase in health insurance premiums. And employers are struggling to continue to cover their people, and so they're paying more health insurance premiums, they're passing more on to the employee, and there's no money left for other benefits. That's a huge reason for wages being flat, pensions kind of going away or dwindling, just because people are struggling to continue to pay for health insurance. Now, the Millman Medical Index is published every year, and and what they do is they do surveys and they figure out how much total medical costs are per family in the U.S. That includes everything: dental care, over-the-counter medication, co-pays, deductibles, everything that your health insurance doesn't cover, over-the-counter medication. And in 2015, it was $24,000, with health insurance being about $17,000. Now, most people don't realize they're spending this much for medical coverage and medical care because they're healthy, they're working, their employer is paying most of the premiums, and they didn't get sick and have to go to the hospital and then deal with their insurance company to get the bills paid. So people don't realize this, but $24,000 is a lot of money when the median household income, not individual income, was only $53,800. Those two numbers don't compute. $24,000 for medical care, $53,000 for median household income. That's not take-home pay. That's total income. You can see that we're moving toward a tipping point here in terms of affordability. So with the current cost of health insurance, $17,000 for a family, $6,500, $7,000 for an individual, median household income of $53,000. Colorado, it's about $62,000. Can the average worker afford health insurance? The answer is no, unless they're subsidized under Obamacare or unless their employer is paying the clear most of this insurance premiums. And these premiums are only going to go up. Now it gets uglier. The ugly part is summed up by one of the premier British medical journals called The Lancet. This was their cover story or comment as Obamacare was being negotiated through the Congress and decrying the influence of corporate dollars in our healthcare system. And you can't see the bottom there, but during 2009, when Obamacare was being written, $1.2 billion was spent by lobbyists. $1.2 billion. There was a time during that year where there were 13 lobbyists for every one member of Congress in D.C. And this is the medical industrial complex. You think about banking and fossil fuels and the military industrial complex and all the money that's spent gaining influence through legislation. Well, look at the medical industrial complex. 17% of GDP, there's a lot of money there, and there's a lot of lobbying going on. And these are basically the big players in the medical industrial complex. And they're spending 2.5 times on lobbying than any other interest group in the country. And that's why we can't get any fixes done or improvements done with Obamacare, and certainly why we're going nowhere on any kind of significant reform in the near future. And this sums it up. All right. Let me go through now Amendment 69, because it's on the ballot in Colorado. And let me just summarize some of the high points of it. It's what they themselves call quasi-governmental health insurance plan. It's really not a government plan. It's not the expansion of Medicare or Medicaid. It is this entity that's created by law in which the state government collects the premiums in the form of taxes, but the insurance company is run by a board of trustees, ultimately, initially appointed by politicals, but ultimately elected by the members in the plan. To fund this, they're advocating a 10% tax on earned income split between the employer and the employee, and 10% on unearned income, with the cap is $350,000 and $450,000. $350,000 for an individual, $450,000 for a family. And they're hoping to obtain all the waivers to get all the federal money coming into the state now for health care to add into this pot of money, which would expand it from 25 to about 35 billion. So the good aspects here is that it would include all residents, not just citizens of Colorado who have been here for at least a year. It would essentially eliminate all personal medical bankruptcy. It would eliminate all deductibles, and it's not clear how many of or what kind of copay limits there would be. It allows free choice of primary care doctor, but not of hospital or specialist, because that depends on your primary care doctor. Will negotiate prescription drug prices. This is a big deal. You have 5 million people now covered with health insurance. You've got some real negotiating power with the insurance companies, as they do in Canada, where their prices are 40 to 50% less than they are here for the same medications. It'll expand coverage to better cover mentally ill and substance abuse. There's deficiencies here. It'll provide some dental care, particularly for children. And it's fully portable. It's not linked anymore to the employer. So you could freely move from job to job. The employer no longer has to worry about negotiating with insurance companies. And it also covers the medical part of workman's comp that's required now, I think, by the state for employers to cover. The concern I have is the Board of Trustees, because they make all the decisions about $25 to $35 billion a year and how it's going to be spent. There's nothing in the law that talks about a conflict of interest, in that members of this board, if they are employees of special interest groups, they're going to want to continue to preserve their high income stream and high revenues. And that's, I think, one of the major concerns I have. This board is going to be elected, ultimately. And we know how elections go, right? Who wins most elections? It's he who has the dollars. And so that's a concern. And the future cost savings may be overestimated simply because they don't have in the bill some of the big prohibitions that you need to have to control medical costs. For example, global-based hospital budgeting. For example, certificate of need mandate. So if you want to build a new hospital or more hospital beds, you have to prove that in your community there's actually a need for all of this expansion, because that's one of the big ways money is being wasted. That's not in the bill. The HR 676, which is the National Medicare for All bill, prohibits for-profit providers of health care, and it also prohibits insurance companies from providing primary health insurance. This bill does not do that. But why would one vote for this amendment? Well, if people simply do the math, multiply 10% times your income, including your unearned income, includes that. And, you know, if the median household income is $60,000 in Colorado, that's going to be $6,000 a year for family coverage that now costs $17,000. So 80% or 85% of the people living in Colorado will come out financially ahead with this plan. Yeah, it's portrayed as a huge tax increase and a government takeover of health care. It is a huge tax increase, but on net, it's a great savings for most people. So it'll be interesting to see how this comes out. If everybody who likes marijuana votes for it, it might pass. All right, we got some time for questions. That's my rant. I'm happy to... I'm happy to take this show to any group willing to listen to me, formally or informally, and I'll be happy to try and answer a few questions.
You haven't talked about the whole concept of integrated care and paying medical providers help for keeping their patients well as opposed to paying them to perform services. Can you comment on all of that?
Yeah, I mean, that's a wonderful concept, and there are some groups that are doing that. I think it's a great idea. The problem is, what kind of incentives do you give people to stay well? That's a tough one. But yeah, that's one of the ways we certainly should be able to decrease the cost of health care and the utilization of health care. And the advocates of Amendment 69 are advocating medical home kind of concepts, which is why they say you have the free choice of primary care doctor, and that person is supposed to integrate your care. But it really comes down to, how are you going to pay the providers? If you can incentivize the providers to then turn around and incentivize the patients to do it, it would work.
Doctor, thanks for taking us into the details and the weeds of all the aspects of Obamacare. When I look at healthcare, I get a little disturbed by the frame, or I don't understand how we can move the frame of how we discuss healthcare in this country. We tend to think of healthcare as a private good in this country. It's a private good. And when we talk about a public good, then all we get is a public rant about that this is socialism. How do we move from this discussion of what healthcare should be in this country and to somehow engage in the very fundamental philosophical debate about healthcare rather than the weeds? We get caught in these details. How can we get to the fundamental principle of, is this something that we as citizens of the United States owe one another? Or is this something, pull ourselves up by the bootstraps, and that we have to do this as a private good, and we pay the our corporate healthcare providers, and we get what we deserve?
The fundamental question we have to answer as a people is healthcare a right or a privilege that can be afforded, that you can get if you can afford it? Because that's where we are now. 23 other countries in the world have decided it's a right, and they provide it. Think about life, liberty, and the pursuit of happiness. At least two of those things you can't have if you're not healthy. This is a national tragedy. We're spending twice as much as most other countries, and we're getting so much less for it. And our outcomes are not good. Question?
Most of the unintended consequences you listed, one of which was employers going to a 30-hour week, they may have been unintended, but they were widely anticipated when the act was adopted.
Yeah.
There were a lot of people talking about that occurring. And a comment or a question, if I might, about the difference in overhead between insurance companies and Medicare. Medicare is 2 or 3%. Insurance companies, I think you said, was 21%. But almost all of the fraud and abuse comes in the Medicare program.
Almost all of the what?
All the fraud and abuse is in the Medicare program because the insurance companies keep close tab, I think, from my experience, on what's being spent and how.
That's true. There's far more fraud and abuse with Medicare payments because Medicare pays bills with essentially no questions asked, and they ask questions later, and that's how they discover the fraud and abuse. But when you consider that 83% of our health care dollar covers 20% of our population. And that's primarily end-of-life care, ICU care, elderly care. This 83% of the health care dollar covering 20% of the population, most of that is paid for by Medicare and Medicaid. The private insurers insure the healthy, people who are working. That's the healthy 80% of our population. Think about if we had 100% of those people in the risk pool, where we had the healthy paying in as well as the sick, and we could be much more efficient, healthcare could be much more affordable, and we can decrease our overhead dramatically and take that money and put it toward healthcare. I mean, the ultimate solution here, when the system implodes, and it's going to, is going to be to stand up and say, let's just take Medicare, improve it, fix some of the problems like the prescription drug plan and negotiating drug prices, and expand it to cover everybody.
I have perhaps a statement as much as a question. You had some great data about the lobbying costs and the amount spent and how much of it came in this medical area. And on some hand, lobbyists do bring information to legislators and congressmen and senators that they may not have had. But we also know that a huge part of lobbying is obfuscation. You know, that it is designed to create confusion as to what's going on, and it's very easy for a lobbyist to be seemingly advocating this position, but in reality they're representing somebody over here that this position happens to benefit. And I don't have the answer. I'd heard the question about public dialogue when you were there. How do we get a civil discourse on this issue? And yet, the lobbyist role, unfortunately, particularly in the last 10 or 15 years, have made it much more difficult to do that. So I guess I'm not asking for a question, but maybe to ask you to amplify.
Well, if you read H.R. 676, which is like a 30-page bill, it goes a long way to eliminating the influence of lobbyists because it prohibits the for-profit corporations from providing medical care, and it prohibits private insurance companies from providing basic care, and it expands Medicare to cover everybody. Now, that's a social insurance program. That's not socialized medicine. And that's ultimately, I think, the only solution, unless we do it like Switzerland, where they strictly regulate private insurance companies, keep their overhead at about 5%, and have them involved in the mix.
I guess I have a comment as well as maybe a question. I do take issue with a couple of the things that were said. One note is that in your commentary, it mentioned private insurance companies as for-profit. I happen to sell health insurance, just so you have an idea of my bias. But Kaiser Permanente is a nonprofit, Rocky Mountain Health Plan is a nonprofit, and the Colorado Cooperative that went out of business was also a nonprofit. My point is that those entities, for-profit or not-profit, are not immune from the crisis of health care and the cost of coverage. And the cost of coverage is directly related to the cost of care and the abuses and the lack of prevention and the lack of attention that individuals need to take in order to stay healthy and to take some ownership in their own health care for us all not to pay for it. One of my issues with the Colorado Care Bill is that there's nothing in that bill that addresses the real cost of health care, which is us taking individual responsibility for our care. And there are no co-pays, no deductibles, no cost sharing, and I don't see any change in the abuse. So those are just a couple comments, and appreciate your views. Thank you.
Yeah, let me comment on that. If you look at other countries, most of them have more people smoking than we do. They certainly have their share of obese people, and they still manage to provide the coverage for them. There's always going to be people who aren't going to take care of themselves, and I don't know what you do about that. Copays and deductibles, right now, if they're high enough, they dissuade people from getting any medical care at all. So we have diabetics, their diabetes is out of control because they can't see a primary or don't see a primary care doctor. We have people who really need some elective surgery who can't get it because they can't afford it. It's a trade-off here. Let me just show real quickly, I'll take one more question, and there's a trailer for a new movie called Fix It. This movie was funded by a small businessman in Pennsylvania who got tired of dealing with health insurance companies. It's really geared toward business people and what's going on in healthcare. I'll show you the trailer, and I'll let your club know how you might access the movie in the future. Yes, sir.
Just a quick comment, and that is, it's important to recognize that in Denver, we pay more for hospital care than most every other city in the country. And that's simply because the hospital operators have been successful in negotiating better reimbursement rates from insurance companies than other places. And in many instances, Denver, we're paying 2 and 3x for the exact same services that other places are doing. So ultimately, and in the interest of full disclosure, I'm a lifelong Republican. I literally have a letter signed from Ronald Reagan on my office wall. But at the end of the day, if we're really going to fix this issue, it seems that Medicare for all does make sense. But what you do it is you close the VA, which is an abomination and provides very poor care. You close Medicaid. You create a super Medicare for the veterans in benefit for their service to the country. And by doing that, you actually have first a $300+ million person risk pool, so you can decrease the price. But you also have finally the negotiating power so that the price of a hip replacement is essentially the same across the country, and it doesn't fall into the success of individual negotiations based on the oligopolies that exist in every major market in the country.
You've identified why costs are so out of control. Medicare does control costs because they set they set the payment schedule. And you'll hear hospitals complaining that we're losing money on Medicare. I don't see a single hospital that is denying care for Medicare patients. I mean, why would you stay in business if you're losing money on half of the patients that come to your hospital? That makes no sense. Administrative overhead of hospitals is incredible compared to other countries, and some of it is necessary because of private insurance, and some of it is for other reasons. So let me show you this trailer, and I don't want to keep you any longer. I know you want to run home and watch the two debates. Is there a way to get the volume on there? Anyway, I don't understand why business people continue to put up with negotiating with insurance companies every year. You have one person get sick in a small business, what happens to your premiums? They go through the roof. That should not be happening. And people continue to put up with it. What happens with Medicare and Medicaid under Amendment 69? It appears the bill says that for Medicaid, the revenue stream from the federal and the state government, they want to continue to have in, but they'll cover them under Colorado Cares, and the providers will get paid more because they'll be covered just like everybody else. If you have Medicare, they expect you to continue to keep your Medicare, but they will then provide the supplemental insurance, and they also will provide for people who want it Medicare Advantage. But Medicare does not go away.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current costs of the system are becoming intolerable.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation.
As a result of foreign competition, our gross profit margins deteriorated. We had to watch every penny of overhead.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current cost.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation. If I had to increase my costs by over $1 million because of insurance coverage costs, that alone would probably drive me to bankruptcy.
Why are we making it harder for people to provide goods and services to the American public while employing people and providing tax revenues?
Healthcare costs are going up 2 to 2.5% above the projected gross domestic product. So it is running away from us.
Health insurance is a really complex system.
I cannot read my insurance policy. I don't understand it.
The variation in what hospitals are getting paid was more dramatic than we thought.
How are the prices set? I'll wager you have no idea.
Nobody really knows what it costs, and what healthcare systems have learned is that they can charge whatever they want.
You see, there's no accountability. The buck doesn't stop anywhere.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why a third of Americans don't get the healthcare they need.
Pity the poor company that's more labor intensive than us. They are going to suffer dramatically. And if they're having bad years, if they're on the verge of collapse, this is going to push them over.
We are undermining our capacity to function, let alone compete as a society, because of the rising costs of healthcare.
If I told you that every one of your employees could get the health care they need guaranteed, that your costs would go down, everyone would pay less and get more. You might be skeptical.
Just imagine what it would mean for this country if we could cut our health care bill by 25%. Imagine what it would mean for our business community not to have this albatross around their neck. It would be extraordinary.
Okay, I have some cards here if anybody belongs to a group, church or whoever, and wants me to come and sit down and talk about these issues. I'd be happy to do it. I thank you for the invitation. I know some of the things I've said might be a little controversial, but I guess that's just the way life is. Thank you.